Diseases of ear, nose, and throat, and head and neck surgery by P.L. Dhingra. Anatomy of the ear, the internal ear or inner ear or labyrinth. The internal ear or the labyrinth is an important organ of hearing and balance. It consists of a bony and membranous labyrinth. The membranous labyrinth is filled with a clear fluid called endolymph, while the space between the membranous and bony labyrinth is filled with perilymph. The bony labyrinth. It consists of three parts: the vestibule, the semicircular canals, and the cochlea. The vestibule. It is the central chamber of the labyrinth. In its lateral wall lies the oral oval window. The inside of its medial wall presents two recesses, a spherical recess which lodges the saccule and an elliptical recess which lodges the utricle. Below the elliptical recess is the opening of aqueduct of vestibule through which passes the endolymphatic duct. In the posterior superior part of the vestibule are the five openings of the semicircular canals. 2. The semicircular canals. They are three in number: the lateral, posterior, and superior, and lie in planes at right angles to one another. Each canal has an ambulated end which opens independently into the vestibule and a non ambulated end. The non ambulated ends of the posterior and superior canals unite to form a common channel called the cusp commune. Thus, the three canals open into the vestibule by five openings. 3. The cochlea. The bony cochlea is a coiled tube making 2.5 to 2.75 turns around the central pyramid of bone, called the modulus. The base of modulus is directed towards internal acoustic meatus and transmits vessels and nerves to the cochlea. Around the modulus and winding spirally like the thread of a screw is a thin plate of bone called the osseous spiral lamina. It divides the bony cochlea incompletely and gives attachment to the basilar membrane. The bony bulge in the medial wall of middle ear, the promontory, is due to the basal coil of the cochlea. The bony cochlea contains three compartments: scala vestibuli, scala tympani, and scala media or the membranous cochlea. Scala vestibuli and scala tympani are filled with perilymph and communicate with each other at the apex of cochlea through an opening called helicotrema. Scala vestibuli is closed by the footplate of stapes, which separates it from the air-filled middle ear. The scala tympani is closed by secondary tympanic membrane. It is also connected with the subarachnoid space through the aqueduct of cochlea. So we'll see into the look into the diagrams. Figure 1.17a, left bony labyrinth. Here we can see the cochlea, oval window, superior semicircular canal, posterior semicircular canal, and lateral semicircular canal. This is the crus commune. Here we can see the round window. B is the left membranous labyrinth. Here we can see the cochlear duct, ductus reunions, saccule, utricle, crus commune. Then we can see the endolymphatic sac, endolymphatic duct. C is a cut section of the bony labyrinth. Here we can see the osseous spiral lamina, scala tympani, opening of the cochlear aqueduct, opening for endolymphatic duct, elliptical recess for the utricle, and spherical recess for the saccule. This is the scala vestibuli. In this diagram, we can see a cut section of the right temporal bone showing entire cochlea, osseous spiral lamina, and horizontal and superior semicircular canals opening into the vestibule. Here we can see the horizontal semicircular canal, cut section of the oval window, round window, osseous spiral lamina. Here we can see the cochlea, vestibule, superior semicircular canal. Cut section of another temporal bone showing oval window, round window, and secondary tympanic membrane. Here we can see the secondary tympanic membrane, osseous spiral lamina. We can see the scala tympani, cochlea, section at promontory, scala vestibuli, oval window, horizontal semicircular canal. A section through the cochlea to show the scala media, also called the cochlear duct, scala vestibuli, and scala tympani. Here we can see the modulus, spiral ganglia, osseous spiral lamina, scala vestibuli, scala media, and scala tympani. Here we can see the Reisner's membrane, spiral ligament, stria vascularis. Here we can see the basilar membrane. We'll go into the membranous labyrinth. It consists of the cochlear duct, the utricle and saccule, and the three semicircular canal and the endolymphatic duct and sac. First, we can learn about the cochlear duct. It is also called membranous cochlea or the scala media. It is a blind, coiled tube which appears triangular on cross section, and its three walls are formed by the basilar membrane, which supports the organ of Corti, the Reisner's membrane, which separates it from scala vestibuli, C, the scala vascularis, stria vascularis, which contains vascular epithelium and is concerned with secretion of endolymph. Here we can see in figure 1.20 a diagrammatic representation of the perilymphatic system. CSF passes into the scala tympani through the aqueduct of the cochlea. Here we can see the CSF, aqueduct of cochlea, that is formed by the formed in the subarachnoid space. Here we can see the round window membrane, scala tympani, scala vestibuli, helicotrema, stapes. Scala media, which contains the endolymph. Cochlear duct is connected to the saccule by ductus reunions. The length of the basilar membrane increases as we proceed from the basal coil of the apical coil to the apical coil. Therefore, higher frequencies of sound are heard at the basal coil while lower ones are heard at the apical coil. Utricle and saccule. The utricle lies in the posterior part of the bony vestibule. It receives five openings of the three semicircular ducts. It is also connected to the saccule through utriculosaccular duct. The sensory epithelium of the utricle is called macula and is concerned with linear acceleration and deceleration. The saccule also lies in the bony vestibule, anterior to the utricle and opposite the stapes foot plate. Its sensory epithelium is also called the macula. Its exact function is not known. It probably also responds to linear acceleration and deceleration. In Meniere's disease, this distended saccule lies against the stapes foot plate and can be surgically decompressed by perforating the foot plate. Third one, semicircular ducts. There are three in number and correspond exactly to the three bony canals. They open in the utricle. The ampulated end of each duct contains a thickened ridge of neuroepithelium called the crista ampullaris. Four is the endolymphatic duct and sac. Endolymphatic duct is formed by the union of two ducts, one each from the saccule and the utricle. It passes through the vestibular aqueduct. Its terminal part is dilated to form endolymphatic sac, which lies between the two layers of the dura on the posterior surface of the petrous bone. Endolymphatic sac is surgically important. It is exposed for drainage or shunt operation in Meniere's disease. Inner ear fluids and their circulation. There are two main fluids in the inner ear, perilymph and the endolymph. Here in figure 1.121, we can see basilar membrane is straightened and viewed from above. Its fibers are short at round window and progressively increase in length towards the apex of cochlea. This is the round window, this is the basilar membrane, this is the apex of the cochlea, this is the osseous spiral ligament. Inner ear fluids and their circulation. There are two main fluids in the inner ear, perilymph and endolymph. Perilymph. It resembles extracellular fluid and is rich in sodium ions. It fills the space between the bony and the membranous labyrinth. It communicates with CSF through the aqueduct of cochlea, which opens into the scala tympani near the round window. In fact, this duct is not a direct communication but contains connective tissue resembling arachnoid through which perilymph percolates. There are two views regarding the formation of perilymph. One, it is infiltrate of blood serum and is formed by capillaries of the spiral ligament. And two, it is a direct continuation of the CSF and reaches the labyrinth via the aqueduct of cochlea. 2. Endolymph. It fills the entire membranous labyrinth and resembles intracellular fluid, being rich in potassium ions. It is secreted by the secretory cells of the stria vascularis of the cochlea and by the dark cells present in the utricle and also near the ampullated ends of semicircular ducts. There are two views regarding its flow. One is the longitudinal and two is the radial. Longitudinal, that is the endolymph from the cochlea reaches saccule, utricle and endolymphatic duct and gets absorbed through endolymphatic sac which lies in the subdural space. And 2. Radial, that is endolymph is secreted by stria vascularis and also gets absorbed by stria vascularis. This view presumes that endolymphatic sac is a vestigial structure in man and plays no part in endolymph absorption. Composition of endolymph, perilymph, and CSF is given in Table 1.2. Composition of inner ear fluids and CSF. Sodium, potassium, protein, and glucose. Values are average and may differ according to the site of collection of endolymph, cochlea, utricle, sac, and perilymph, scala tympani, or scala vestibuli. We have the endolymph, perilymph, and CSF. Sodium in endolymph is 5 milliequivalents per liter. Perilymph it's 140 milliequivalents per liter, and in CSF it's 152 milliequivalents per liter. Endolymph potassium is 144 milliequivalents per liter, and perilymph it's 10 milliequivalents per liter, and CSF is 4 milliequivalents per liter. Protein is 126 milligram per deciliter, perilymph 200 to 400 milligrams per deciliter, and CSF is 20 to 50 milligram per deciliter. Glucose in endolymph is 10 to 40 milligram per deciliter, perilymph is 85 milligram per deciliter, and CSF is 70 milligram per deciliter. Blood supply of labyrinth. The entire labyrinth receives its anterior supply through labyrinthine artery, which is a branch of the anterior inferior cerebellar artery, but sometimes from the basilar artery. In the internal auditory canal, it divides in the manner as shown in the figure. Venous drainage is through three veins, namely the internal auditory vein, vein of cochlear aqueduct, and vein of vestibular aqueduct, which ultimately drains into inferior petrosal sinus and lateral venous sinus. The following should be noted. Blood supply to the inner ear is independent of blood supply to middle and bony aortic capsule, and there is no cross circulation between the two. 2. Blood supply to the cochlea and vestibular labyrinth is segmental. Therefore, independent ischemic damage can occur to these organs, causing either cochlear or vestibular symptoms. Figure 1.22. Divisions of the labyrinthine artery which supplies blood to various parts of the labyrinth. Labyrinthine artery from anterior inferior cerebellar artery, common cochlear artery, and anterior vestibular artery, which gives to utricle and lateral and superior canals. Common cochlear artery gives branches to vestibulocochlear artery and main cochlear artery to cochlea 80%. Under vestibular cochlear artery, we have cochlear branch to the cochlea 20% and the posterior vestibular artery to saccule and posterior canal. This is the blood supply of the labyrinth. Here we can see the anterior inferior cerebellar artery. This is the labyrinthine artery, common cochlear artery, main cochlear artery, that is 80% to the cochlea. This is the vestibulocochlear artery, and this is the cochlear branch, 20% supplied to the cochlea. And here we have anterior vestibular artery, gives supply to utricle, superior and lateral canals. And then we have the posterior vestibular artery, the posterior canal, and saccule. This is the blood supply of the labyrinth. Okay, thank you.